Hi guys, this is Dr. Sattar from the YouTube channel Doctor to Help. Hope you're all doing great wherever you are. Thank you for joining me. Today we are going to talk about diabetes. For those who don't know me, I'm an internal medicine doctor, board certified, practicing in Texas. All right, let's talk about diabetes today. What are the types of diabetes? How many people are affected by it? And what are the complications? How does it work? Let's talk about it. I'm going to keep it very short and simple so it's easy for everybody to understand and they don't get confused. There are mainly two types of diabetes, type 1 and type 2. What happens in type 1? It's an autoimmune process. It's a messed up autoimmune process in our body where our body thinks that the beta cells that produce our insulin is actually our enemy and they go and attack and try to kill them. When they keep on doing that, at one point when there's 90% destruction, there's not enough insulin to compensate anymore. And that's how we have type 1 diabetes. So what does insulin do? Insulin keeps the blood sugar down. How does it do it? Insulin has a way of affecting the cell wall. And inside the cell, it has some glucose transporters that it activates. Those glucose transporters comes and attaches to the cell wall and makes those glucose go in. So when insulin's around, that's its job to help the cell to get the glucose in. So if there's no insulin, the glucose cannot go in. So the glucose starts rising in the blood. Also, there's another hormone that is released in stress and infection. It's called glucagon, and that glucagon's job is to keep the blood sugar high so your body has enough blood sugar to fight the infection. So it's a vicious cycle, right? So let's talk about type 1 diabetes. What is alpha and beta cells? Alpha and beta cells are cells that are in the pancreas at the area of islets of Langerhans. In the middle, there's the beta cells, which produces insulin, and the surrounding cells are the alpha cells, which produces glucagon. Together, they keep the blood glucose in balance. If any one of them are out of order or breaks the balance, we are in trouble. All right? So in type 1 diabetes, what happens? In type 1 diabetes, when you have too much glucose in the blood and the cell is not getting that glucose for energy, cell has to do something to survive, right? So it starts breaking down the muscles and the adipose tissue, the fat cells. So when the fat is broken down, it produces fatty acids, and the protein is also broken down, and that's how people lose weight in type 1 diabetes. So when there's too much of this, if the body is totally out of control, up to 90% destruction of beta cells, there's enough insulin to compensate the body needs. Once the beta cells are destroyed more than 90%, there's not enough insulin. So body starts producing more and more blood sugars and it starts going up and up and up. So to compensate fatty acids, they start breaking more and more lipids. It produces the free fats. It goes to the liver. Liver produces fatty acids that turns into ketone bodies. Ketone bodies can be utilized by the cells as energy, but it also produces the increased fats or ketone bodies that is in the body, and it causes increase in acid. When there's too much acid in the body, it's poison. A human cannot tolerate it, they can die. So to compensate, they start breathing very fast. It's called cosmos breathing. What it's doing is trying to get that CO2 out into the air to reduce the acid. What kidney is doing, in the cell, before it goes to the kidney, before it goes in the cell, there's something else going on. Cell is seeing all that hydrogen ion in the blood, so it starts sucking it in, all the hydrogen ion, and to replace it, sends out the potassium. So more and more potassium starts going up in the blood, and hydrogen is going into the cell. So when more and more potassium is going, kidney is saying, oh, no, that's too much potassium, you need to go. So it kicks some potassium out through the urine. And it's also kicking out some glucose. When glucose is going, guess who's following it? Because glucose is an osmotic particle. Water is following it. So there's increase in volume of urine. So your going a lot and you're losing a lot of volume and you are creating dehydration. So in DKA, known as diabetic ketoacidosis, a complication of type 1, you have three things: too much acid in your body causing DKA, you have hyperkalemia, you have hyperglycemia, that means high potassium, high blood sugar, and dehydration. So when these patients come to us in the ER or in the hospital, guess how we treat them? We give them fluid. We try to give them up to 2 liters of fluid, flushed it in through the IV. We also give them potassium, we also give them insulin, and that's the treatment for DKA. So what happens in type 2? In type 2, this is an insulin resistance. So what is happening? Insulin is there, but it doesn't work in the cell level. What insulin is doing, think about a door. There's a key and you're trying to get into the keyhole and you're turning it, but nothing's happening. And you look into the keyhole, there's something stuck in it. It's blocking it. So that's how it feels in type 2 diabetes. The insulin is there, but it doesn't work. So if it doesn't work, the blood sugar cannot go in. So glucose is not going into the cell. So it's a failed mechanism. So what does the body do to compensate? Remember, there's beta cell and the alpha cells. The beta cells produce the insulin, right? So this beta cell starts getting very big in size. They proliferate, they increase in number, and they try to compensate and make more and more insulin. When there's enough insulin, it can push that cell and make it work, make those transporters work so that glucose can go in. But how long can the body do it? How long can our pancreas produce insulin like that? If it's overproducing, at one point it gets tired. So those beta cells that were hypertrophied, they start getting fatigued, they start shrinking, and they die. When there's 90% destruction, guess what? We start having our symptoms. Body can tolerate up to 90%. So now we are again having the same symptom, polyphasia. You're hungry a lot because cells don't get energy. They're breaking down their lipids, their muscles, so they're hungry. So they trigger the polyphasia, and you're hungry all the time, you want to eat. 2, you are getting rid of all that glucose in the urine and volume, so you're peeing a lot and causing dehydration, right? All these things, polyuria, polydipsia, you get dehydrated and you start drinking water. So it's a vicious cycle. So at this point, what can you do? Remember, it's an insulin resistance, right? And insulin resistance can happen for several reasons. Part of it can be genetic, part of it can be obesity, hypertension, all these contribute, and they think more other factors are coming in and we don't know yet the whole story in type 2 diabetes. So we are still digging into it. Until then, what can we do? We can lose our weight. We can manage our diet. We can exercise. And if all those doesn't work, we can take medication, oral medication, and that fails, guess what? You go to insulin. All right? So this is a pathophysiology of type 1 and type 2 diabetes. In my next video, we are going to talk about management of diet in diabetes, complications. All right? We're going to do it in 2 separate videos so that we don't put in too many minutes in each video and fatigue you. So this way, those people can target to which video they need to watch, and they can watch it multiple times if they want to. And if they don't want to see the pathophysiology, it's too boring, they don't have to. But I definitely want you to watch the video that does the diabetic diet management and also the separate one for complications. All right, see you next time. Thank you for joining me. Take care. Bye-bye.